everyone. My name is Guilherme Correia. I'm a Chief Hematology and Oncology Fellow at Mayo Clinic in Jacksonville, Florida. And I'm also a GRACE Patient Ambassador for the year of 2024-2025. And today I'd like to talk to you a little bit about a new type of drug cancer treatment that's called bispecific antibodies. And this is going to be a small series of videos talking a little bit about how do they work, which is today's topics, about their side effects, and what are the indications in treatment of those patients with solid tumors like lung cancer and others, and patients with blood cancers like leukemia and lymphoma. So today we're going to focus, as I said, on how do bispecific antibodies work. But before we start that, I'd like to begin taking a step back and looking towards the types of cancer treatment that we have. And the way I like to explain this is that we have two different big groups of therapies. One of them is what we call local therapies, those that are acting on the tumor directly. And the most classic one, I would say, it's probably surgery, or actually the surgeon, usually an oncology surgeon, is going to perform a type of surgery to do the removal. But sometimes it can actually be radiation therapy, when our colleagues, the radiation oncologists, are going to use specific radiations to kill the cancer cells. But the type of drug we're talking today, the bispecifics, they're actually part of the other group, the group that's called systemic therapies. That's a very extensive group, so I'm going to summarize a few of their characteristics. One of them is the very classic that everyone has heard about, which is chemotherapy. But you also have some of the newer medications, one of them, for example, being those that attack and involve the immune system. So, for example, we have the immunotherapy, like drugs like pembrolizumab or Keytruda, and other ones that are actually trying to use similar structures like our own antibodies that we have in our own body, but to attack the cancer cells. And those are drugs like rituximab or Rituxan. We also have some treatments that actually come in pill form, and those can be either a targeted therapy that is acting directly on the cancer changes in the DNA. As we know, the cancer, actually, those cells, they suffered a lot of changes in their DNA, so they start to act rogue in our system. But some pills can actually target that directly and kill the cancer cells from there. Sometimes you can also use pills that actually contain hormones, and that is going to help patients like those with breast cancer or prostate cancer. And the last type that we have is more focused on those patients that have those blood cancers. And those are the newer therapies called CAR T cells, where actually it's a more specific process and we won't focus too much today, or even a blood transplant or bone marrow transplant, as I should say, where actually patients can undergo an extensive procedure to have those diseases treated.